Nurses are experiencing burnout at an unprecedented rate. The alarms are sounding and the system's flatlining. As technology advances, the solution we may seek may be beyond human limits. Is artificial intelligence the unexpected answer to nurse fatigue? Or is it just another Band-Aid on the wounds of our healers? On this episode, we will explore innovative tools helping us to identify, predict, and prevent nurse burnout, all while supporting nurse well-being. Welcome to Healthcare Disrupted. Welcome back to another episode of Healthcare Disrupted. I'm super excited to be back with you all today, and I think we have another exciting topic. We're going to continue to delve into technology and the topic of technology and how technology is helping us inside of healthcare. And so as we think about technology today, we're going to take a little bit of a pivot and think about this from a different perspective. And we're going to think about it from the conversation of burnout. Burnout has been increasing inside of healthcare. It has been negatively impacting our clinicians and really started impacting clinicians prior to the pandemic and has only escalated since then. And so burnout's a really important topic. And so we want to talk to our guests today and really think about, is there a way to think about burnout differently? We've all been working hard on burnout, trying to decrease burnout. We talk about resilience a lot, but I don't know if we've moved the needle as much as we could. So we have an exciting guest with us today, and I'd like to welcome Julie Winegar, our System Director of Clinical Workforce Planning. So welcome, Julie.
Hello, Amy. Thank you so much for having me today on this podcast on this very important subject.
Why don't you start by telling us a little bit about yourself and why you're passionate about the topic of burnout?
Absolutely. My name is Julie and I'm a nurse. I've been a nurse for 25 plus years and have really enjoyed every aspect of my career. The majority of my time I've spent in the adult ICU and also in the emergency room. A lot of that work has brought me to really like data, to be able to really see how we can use data to be able to help patients improve quickly and get better faster. And then as I have moved through my career, I've started to really enjoy seeing how we can use data and analytics to be able to really help processes, to be able to really help processes, to improve workflows, and also to improve the work environment for nurses and healthcare teams in general. As much as I loved taking care of patients, I really love taking care of nurses. And this is my new passion, is to be in a space where I can work with an incredible team to work on stabilizing the workforce in order to help nurses do what they do best and bring joy back into nursing.
So, Julie, as you think about burnout, tell me what burnout in healthcare means to you.
I'm passionate about burnout because the job of a nurse is very taxing. I think it's uniquely taxing physically, mentally, and emotionally. I think that because of the taxing nature of the work and also the DNA of the nurse, that compassion and that empathy paired with the intelligence and the drive to really improve things for patients can lead us to getting to a point where we're giving more than we really realize we're giving, and that we're doing more and we're maybe not taking care of ourselves like we believe we need to in order to keep going. During my career, I've had periods of time where I've had some burnout. And experiencing some burnout, I had an amazing leader be able to lean in and be able to really help me recover from that time, to be able to take, to rest some, to be able to see how I can move past that burnout and really launch me into a new space. I really wanted to use the experience and all of the lessons I learned during my experience with burnout to be able to help nurses really launch themselves into their space and help them do what they do best.
And you know, we throw around the topic and the word burnout in healthcare a lot. And it's talked about a lot lately. Maybe it will be helpful for us just to pause for a minute and think about what the term actually means. And for those of you who might not know, burnout is actually a clinical definition. It has a clinical definition. It's a clinical terminology that really means three things. It's folks who are experiencing emotional exhaustion, depersonalization or detachment, and cynicism, really from the profession that they do. And so this is a phenomenon that we've seen be increasing across the healthcare profession. And we're talking about nurses in particular today, but we actually see the phenomenon of burnout impact all of our clinicians. So Julie, as we think about burnout, you've talked about, we've all done lots of things in healthcare. We've asked people to take more time off and try to work on themselves and practice meditation and prayer and other things that might be important to them and exercise. But despite all of these efforts, we probably haven't made as much progress as we'd like. And so I'd love to hear about how SSM Health is approaching burnout differently than other healthcare organizations, because you're leading some of that work here.
Yes, very excited that SSM Health is one of the first healthcare organizations that is approaching burnout differently by utilizing some AI tools. We are very fortunate to be partnered with an AI company around predictive analytics called Atalan. Atalan is a company that utilizes machine learning and predictive analytics to take a look at patterns to help us predict burnout quicker. We can start looking at different patterns that we're seeing, whether we have different patterns in attendance, whether we have patterns where we have increased strain for the nursing workforce, and what that could do for us. Really utilizing those AI techniques with Atalan, we're able to really expand both the breadth of our view about what is really happening with our workforce and also the depth of our view. It really helps us to be able to use those AI tools to be able to identify what's happening and to be able to just lean in at the right time and at an earlier time before we really see the effects and the detrimental effects of burnout.
That's great. And how are we doing that, Julie? Do you have any tools? Is there anything we're using that's helping us identify burnout earlier?
Atalan does have a lot of tools that they have set up and ready for us. I will say that one thing that is so special about partnering with Atalan is that we are building this tool with them. We are building the tools with nurses that are actively working at the bedside. We're asking the questions around what causes strain in your day? What have been the burnout indicators that you've seen as a leader? Leaders are very good at this. We assess, we intervene, we evaluate, right? We're very good at leaning in and assessing these different points of view. But with utilizing AI, we can do that in a broader view. So for example, if we start seeing burnout, if we think that we think a nurse would be burned out if they don't take breaks, I think that's pretty clear. If they don't have time to take a lunch, that is probably an indicator that they're becoming more burned out. So let's take a look at that. Let's look and see how often that's happening. Let's see if that changed over time. Maybe there's a situation where the nurse is getting harder assignments day to day. Let's take a look to see what those indicators are. And we're really looking at different data points like that. And we're getting data points from nurse leaders and from nurses working the bedside to build with them to be able to say, can we look at this? We know that this is a clinical observation. Atalan, help us identify the data point you could pull to be able to look at this more broadly and be able to really sense that in the background to be able to see those patterns.
So we had another episode on Healthcare Disrupted where we talked about technology and artificial intelligence and predictive analytics. And so what I think I hear you saying is that we're using technology and all these data points to try to understand and maybe even recognize burnout earlier. Is that a correct understanding?
Yes, we are trying to recognize burnout earlier. There's something to be said for when you start to feel that strain. When we start to feel the emotional, mental, or physical strain of the work, whether that's from within the work or whether that's from what is maybe happening in your personal life, you start to feel it and you push through. You just keep pushing through. And it's like, I kind of compare it to how we're utilizing predictive analytics around early signs of deterioration for patients. We're doing the same thing, seeing that with patients. There are subtle signs when we start to see patients becoming a little bit worse. Maybe their oxygen needs ended up increasing just a little bit. Maybe their heart rate increased a little. Maybe they're sleeping a little less. Maybe their pain's a little bit more, a little less responsive. We're tracking that. And on a previous episode, Saad actually mentioned that SSM is using some of this machine learning for patients with the prediction of early deterioration. This is something that we're doing now for ourselves, and I am so excited that we're doing that and leaning into our own workforce to say, let's start looking at the predictive analytics around burnout. What are the early signs? Can we start intervening? Can we start seeing that earlier and intervening earlier to be able to get us well quicker? We know that we can get patients more well and get them well quicker if we capture that downward spiral quicker. It's the same with burnout. We've got to be able to lean in and be able to start talking about what we can do to recover, what we can do to help protect and support that nurse at a time where they're starting to feel the strain, until the point in time where they have experienced the strain for so many days, months, maybe even years, where they're just to the point where they're now looking for a new profession because they just cannot keep going with this level of burnout. We don't want to ever get to that point. We want to be able to support our nurses every day and to help them feel the joy of nursing every day.
So Atalan is new in thinking about how to use technology and all these data points and predictive analytics to recognize burnout in nursing earlier, but they're not new in this space. They've been doing this in the physician space. And in fact, we've been working with Atalan in the physician space here at SSM Health. Will you tell me a little bit about what we've been learning in that space and what's also applicable to the nursing space?
Yes, we have been working with Atalan in the physician space. The partnership with Atalan in the physician space began in June of 2023. Much of that work is ongoing and developing, and there is a lot of refining and validating happening with the methodology and the dashboards, making sure it's user-friendly. Also, with that same partnership and really cooperative effort in building with the physicians, building what the physicians need. In fact, recently, the work of the physician space of Atalan is led by Dr. Heather Smith. And recently, Dr. Smith and Cece, one of the head data analytical scientists, shared in a grand rounds with a Joy and Wellness conference. They shared some of the patterns that they were able to see and be able to validate some of the methodology. They took a look at the patterns from two separate clinics. This was one of the clinics that they wanted to compare with was a clinic that had an initiative started by the pharmacy team to include a pharmacist in that space. And they compared the patterns of work before that initiative went and also after. And then they compared the burnout risk factors that have been identified from those physicians in both that group with that initiative in place before and after, and with a controlled group, a same like clinic that did not have that initiative be started. And being able to do that, they were able to find that control group, one variable, kind of that scientific method of seeing how this methodology translates into our real work, into real people, into like being able to predict the different workflows and to be able to understand how those workflows are going to affect our patterns that could lead us to burnout. What they were able to find that in the variable group where the pharmacists were engaged, they were able to positively kind of give that stamp of saying, yes, this work did create a healthier environment for physicians because they were able to spend more time with patients, their documentation time went down, their job satisfaction scores went up. And when they interviewed the two different groups, they were able to see in the variable group, that there were two physicians that were kind of on the fence related to leaving that clinic that did end up staying. Was it necessarily because of the initiative? Was it because of the work? Was it because we were watching? Was it because we were asking? It could be any of those things, but what we're seeing is our efforts in the space do make a difference, and it affects it. That methodology helps compare and help us understand. I'm giving you kind of a summary of their amazing work. I know that Dr. Schmidt has spoken about this, and we can maybe put a link related to their study and their analytics and methodology and all the validation that they're doing, just to ensure that our process is sound and trusted and repeatable, so we can do that with other clinicians as we're now stretching out into the nursing space.
Wow, that's really amazing, Julie. Thank you for sharing that. I think that also reflects how complex and how much complexity there is in the phenomenon of burnout. And in fact, the National Academy of Medicine issued a report, I believe in 2019, on clinician well-being. And they had about 7 data points that impacted clinician well-being, and only 2 of those were personal. One of them was personal attributes, and one of them was knowledge and skill set of the clinician. All the other attributes that were impacting clinician well-being were things like the regulatory environment, the complexity within which we work, the rules and regulations, what's happening within our social constructs and our social systems. And so in that example that you just shared about our physicians and how we're utilizing this technology, and our physicians also demonstrates an intervention that had nothing to do with personal resilience and had everything to do with improving the work environment and decreasing workload burden so that our good clinicians can do what they intend to do every single day, which is show up and give really great, compassionate, high quality, safe care to all of the patients whom they're serving. So as you think about that in the nursing space, what kind of data points are we looking at that we want to utilize inside this predictive analytics to think about what could be telling us about either the nurse's workflow or how the nurses feeling about their work environment, or what else is going on both individually and collectively within our nursing population?
The data points we're looking at are data points that we are gathering from our own experience as nurse leaders and working with nurses that have had episodes of burnout. And most importantly, we're asking the nurses doing the work. We are partnering and interviewing nurses that are working and asking them about their day, asking them about what changes in your workflow when you're under strain, both personally or professionally. What are more difficult spaces in your work? Some of the things that we're looking at are related to taking breaks, like I mentioned. Are they able to take lunch breaks? Is their work steady enough but loose enough to be able for them to be able to take care of their own needs, to be able to take breaks from work, to be able to have their trusted peers manage their patients for that time where they can rest and just kind of regroup and take care of themselves for a moment during the shift. Are they feeling ready to start the day? Are they able to come in ready to start? Are they being able to document in real-time documentation, or are we finding that there's no time to document at the moment, so they're finding that documentation all happening later? That's a data point that's been really helpful, that we believe will be really helpful to be able to say, we're seeing that during these times, a nurse can do the work, but they have to find time to document on the other side, where we have computers in every room. We're trying very hard to make sure that the computers are readily accessible so nurses can document at the same time they're doing the care. But sometimes during busy days, and what we're hearing from nurses is they have to set the time to do the work, and then they have to set the time to document the work, which becomes a strain, becomes some double documentation. There's a lot of issues of trying to make sure that they've had everything right. I don't know if you've experienced this, but there's been times where I've got paper towels out of my pockets as a nurse because I've written on the paper towels during the time to make sure I could get everything in the computer, sometimes written on my hand. If that's happening frequently, that's a stressful day. Being able to see maybe that is helpful and an important data point. If some of that time, the documentation time, is taking place later than the shift is over, if your shift end is stretching out because you're giving report, handing off the care, but you still have this extra work to do, what does that look like? Much of this work is we're partnering with some of our friends with Epic, with Cheryl Hager's work, and in Project One, we have some of the bees. One of her bees is part of our steering team, and is very insightful knowing that they are working on this kind of in tandem. And we're just wanting to make sure that as we're creating this all together with everyone's perspectives in place, knowing that there are data points out there. We're just trying to find the right ones and get AI to start learning and being able to capture those patterns to really be able to help us have an idea for where we as leaders need to look and see where layers of strain are happening. First, how to help those nurses. And secondly, how do we lean in and help those processes smooth out? And so we can decrease that workload burden. And so we can really create a well-being environment. We can help support the nurse. We can create a well-being environment, and doing that all together cooperatively with this important initiative.
So Julie, you made two really important points that I want to go back and have you tease out for me. So the first important point is that you talked about that you're going to our nurses. You're going to nurses who are practicing every single day, and you're asking them what's important to them. And so what you're really saying is that the nurses are involved in shaping this technology. Is that correct?
Nurses are absolutely the ones shaping this, and that is very important. In the spaces where we have technology and clinical work interface, there is a translation piece in between. I think we've experienced in the past situations where technology comes in and we almost have to adapt our clinical workflow to match that technology. We want to be absolutely sure we do not do that here, that we focus first on the clinical work and that the technology can match us and to really serve us as a tool. Technology is always a tool. It is a tool for us to assess, and it's a tool for us to evaluate. It's very important that that tool is clinically leaning and not hard on the technology side. We have to make it work like our brains work. And so we are very purposeful, very intentional to be able to set the clinician's mind to be thinking this through with us, to be able to ask the nurses, what does your day look like? They give us these clinical observations, and then we step back and say, okay, of these clinical observations, what data point does that really translate to? And we're going to get better at this, and the machine will get better at this as we try to kind of help our clinical brains press into the technology tool, and not the other way around. We don't want we want our work to be our work and the tool of technology to match us.
So our nurses are really involved in designing the product. And you know that warms my heart, Julie, because I think in order for work processes and workflows and products or technology to be able to be utilized in a meaningful and effective manner, the people who are doing the work must design the work. And so thank you for involving them and making sure that their voices are heard and that their fingerprints are all over this technology. It's super exciting. The second dot point that you brought up that I'd like to go back to is some of the specific data points that you're looking at. You talked about things like missed lunches, clocking out late, different patient assignments, characteristics or attributes of particular patients or disease processes that are going on that might impact the way a nurse is feeling or even perceiving their environment. And what I think I heard here is you're really talking about things that have been normalized in nursing for quite a long time. I mean, there's a time where we would all brag about, we were so busy, we couldn't take a lunch. But it sounds like you're saying that these things could actually be contributing to burnout and to the stress that we're feeling within the environment.
These things absolutely can contribute to burnout. A nurse's job is, again, very taxing. I think of our jobs very much like a game of Twister chess. We start our day, we look at all of these different parts and pieces, being able to really set the board. With strategy, we have a plan of care for the patients. We just want to get them 12 hours more well, get them through their plan of care, get them home to their families. There's a plan in place. It's a chessboard, but we're good at the chessboard. We're ready to go. We start our day, and then all of a sudden it's right hand on green. And we do well with that as well. We're very good at prioritizing. Nurses can then prioritize, keep the game of chess going, but they're always running to that space when patients need something, when a priority comes ahead. If a patient's not doing well, if there's a change in the plan of care, we start playing that Twister chess game, being able to make sure that we are where we need to be at the right time. That all works, and we're very good at swimming those waters. We're very good at it, but there's something different between swimming and then starting to feel like you're drowning. Many things get to the point where it feels like you're drowning. It could just be, I've done this so many times. I've worked a lot of hours. I'm in overtime. I'm more tired. I'm more mentally, emotionally, and physically tired. Maybe you had an event. There's events that definitely strain us more emotionally, and maybe that you're still kind of carrying and trying to get through the process of getting through that yourself, really internalizing it and understanding it, and then being able to move forward from it, knowing that is part of the work. But being able to keep swimming and have the support of the leaders to be able to keep swimming, and to be able to see when that swimming starts to get too heavy, and that there starts to be a little bit of gasping for air. We want to see those moments in the data. We want to be able to see what patterns are happening, where we can quickly get some life preservers out. Like, let's help buoy you up. Let's get you swimming in teams. Let's get you in some calmer waters. What can we do? And so it doesn't feel quite so taxing to get through this next swim lane, like to get through this next lap, to be able to get to the other side of rest. What does that look like? How can we help the workflow help you rest? How can we carve out time so you can rest, and so we can actually get through the well-being exercises of our own health, our own well-being? What can we do to help encourage that, being able to see when we're starting to not be able to swim, instead of when we are deep in and we're gasping and now we're desperate for help and we're so tired. That's the real key, to be able to intervene quickly, to be able to see what's happening today. In that game of Twister chess, we're trying very hard, and we're very dedicated and intentional on getting patients well, and doing it in a compassionate way and in a high quality way. But all of these different parts and pieces layer on, and sometimes it gets to be a little too much. And once we start finding that space, we want to get the life preservers out. We want to be able to help and support each other.
Julie, this is so exciting, and I'm excited about the possibilities that we're talking about, because what we're talking about here could really be transformative when we think about healthcare and healthcare environments, and how do we create healthy healthcare environments for our clinicians to live and work in every single day. One of the things that's important to me as a leader, and has been for a really long time, is it's really easy to point the finger at the clinicians and say, you should take better care of yourself, and you should eat healthier, and you should exercise more, and then you'll feel better. But personal attributes are only one tiny piece of healthy environments. We also have lots of internal factors within our healthcare organization, whether it's rules and regulations or workload burden or other things that impact the work. And then we have the external factors as well. So all of the things that happen within the regulations across our federal government and our state government, the society, all of those pieces. And so this really brings the external factors, the internal factors, and the personal factors together. And I think as a leader, one of the things that's important to me is I should be focused on external factors and internal factors. And how do I mitigate that? And how can I talk about the personal factors of well-being if I'm not working as a leader on those external factors and those internal internal factors that are negatively impacting our clinicians and our healthcare workforce. And so I'm really excited that we are bringing a technology that could potentially bring all of this together. So as we think about wrapping up here today, I'd love to hear a little bit about what are the next steps and where are we headed now?
Our next steps in the program are to continue refining. It's really to refine, validate, start pulling data points, get the machine learning to really start getting integrated, and just kind of watching patterns. A lot of these patterns that we're watching, it's like a bell curve. It's like this is normal, and this is when we're seeing the patterns shifting off of normal. And when we're looking at this, it's really just assessing the entire span of patterns of charting, in the charting, patterns in how we operate, what the workflow looks like. It's just going to be able to help us be able to see when we're falling off of normal. And the idea here is when we're falling off of normal, that's the assessment piece. There's no way a human brain, we would love to be able to do this as humans. I would love to. When I was working as a manager, I would have loved to see all of these insights. But a lot of times I couldn't until a nurse would tell me, hey, I had all of these things happen. Or if I was physically there seeing that this nurse is really carrying a lot, and I've had one-on-ones, and I know that there's some strains at home, but I would have to be really involved, and I wouldn't hear from the person that maybe didn't feel comfortable talking about their burnout. But this is going to really let us span and see things in an organic way, being able to just assess on the background, to not need a nurse to even go to to raise their hand or raise a white flag. We will be able to see. So that assessment, and then to be able to have our program tap a leader's shoulder and say, this is a little bit off of normal. Do you want to go take a look at that here? And that would be able to then start that humanness, to have the leader come in with that compassionate curiosity, be able to say, hey, how are you doing? I'm noticing that these patterns, I'm just noticing these patterns in the data, and I'm wondering if there's anything I can do to help. Is there anything happening where you need some support? And just opening those doors to be able to help a leader be able to lean in with more information and with earlier information. So our next step is to build that dashboard. Right now, we're pulling together the clinical observations from the nurses with interviews. Very grateful for all the nurses being involved with this. So thank you to all of you out there who have been part of it. But then to gather those clinical observations, and then very grateful for our partners in the data space, helping us to be able to look at the clinical observation and have those translate into data points to be able to really get that programmed into a learning module. Once those patterns start going, the dashboard's next, and then that will be when we start trialing that beta version of the dashboard with our nurse leaders to be able to see, is this helpful? Is this match your workflow? Is this what you normally would do? How can we make sure that this information leads you comfortably to your compassionate interventions? Like what we normally would do is we have this assessment piece. That human piece very much is the leader leaning in, and then we span back out to the technology to help us evaluate, are we improving? As this process that we engaged in we thought would help, let's take a look, and then let's quickly see if it's helping. If it's not helping, let's pivot. Let's start a different intervention. Let's keep watching, just like we do as nurses. We're very good at this. We assess, we intervene, and we evaluate, and we pivot if that evaluation is not bringing us closer to wellness.
That's great, Julie. We've talked about lots of exciting things and lots of possibilities, and even, the idea of transformation with some of the data and information that we'll have with this tool. I also suspect this will make some folks nervous, and they'll be worried about whether or not we're monitoring performance or whether or not we're thinking about the individual. Could you address that? And what would you say about those concerns?
I really appreciate you bringing up those concerns, because it's certainly something that we hear and that we want to keep addressing and alleviating some of those fears. I don't think I can say it any better than our Chief Digital Officer has said it at your previous podcast, Saad Chantry, who's been able to really speak to this so well, related to how very careful we are with the governance of utilizing these tools, and the shielding of the specific things that we need to make sure are kept private, and also the very intentional efforts to utilize this work for how it is intended. This work, as we monitor or watch in the background, all of this is purely for well-being. Our Atalan work and the data contracting, there's a lot of governance that goes into that. What is accessible, what is not, how we really go through that governance process. And a lot of that is built on the processes that we already know are very sound, that we have relationships with in the different data sharing, just to make sure that we are doing the right thing and that we are not creating any space that would be detrimental or negative towards the individual. That's exactly what we don't want to do. We are working toward that positivity to bring forward the individual, not to create any kind of feeling of oppression. It's really to lift that individual and to understand those patterns, to really use these tools in the right way for the very intentional reason for well-being, in an effort to enhance the work and to really amplify the workforce, understand the workforce in a proactive way. We want to understand the workforce before we're doing an exit interview and asking, well, what were the pain points for you? That's way far down the line. We want to be able to understand when someone's experiencing the pain points, maybe even before they really feel it, but we see it, we can see it, we can see that the patterns are starting to happen, and we are utilizing that only to be able to lean into the well-being, not for any kind of evaluation or performance. We're leaning leaning into a technology with our very human heart to say, let's look at this together. Let's understand how we can elevate and enhance one another.
And so this is really about leaders thinking about the impact that we have every single day within the organization and external to the organization, and what we can do differently to decrease burnout within our workforce. So I appreciate that. Any closing thoughts or remarks, Julie, as you think about our conversation today, and maybe even what you're most excited about in the future?
I am very excited about the future. I'm very excited about utilizing new technology and innovative tools to be able to do our work better for each other and for our patients. I very much believe if we can help a nurse be in their best space, they will be able to deliver the most amazing care. Nurses absolutely can unfurl their capes to do what they want to do what they do best, to really give to the patients emotionally, physically, and mentally, with their unbelievable skills, unbelievable talents, to be able to really lean in and be able to kind of just help them open up and let them go and work and do what they want to do, decreasing workload burden and being able to understand what pain points they have when they're feeling less well. If we can enhance that, I think that we would see a very positive shift in every aspect of healthcare. Most notably in the culture of healthcare, I do believe it will help not only stabilize our workforce, but will really help our workforce thrive. And in a thriving space where you have a workforce thriving, patients are going to get amazing care. They're going to be seen. We're going to be more comfortable with change because we're well and we can lean in and we can explore and we can become creative and curious. When we're in a space of strain, we just are trying to take the path of least resistance. If we can get into a space where we're feeling well and curious and active and ready to troubleshoot and ready to lean in and problem solve with our leaders and all together, then we can really get to a great place. So I'm very, very excited. And I think that there's a lot of things that we can do. I would say to all of my nursing friends out there and nursing friends and peers out there, please lean into this work. Help us hear you. Help us hear your voices. The more we can hear and understand what is happening and what really you're seeing at your day-to-day, we know the work has changed. We know that, I've been a nurse for 25 years. the nurse I was when I first started is very different than the nurse I am this year, and very different than the nurse I was 10 years ago, because the work is different. Our patient population is different. Our patient needs are different. Help us come up to that speed. We haven't changed a lot of things in how we work, but SSM's at the forefront. I'm very excited to be part of this organization and part of the exciting work on innovation and transformation and disruption. Like, the work has changed. Let's change some of our workflows. Let's change some of our tools. Let's lean in together and help us. We're only better together, and we will only move forward if we can hear you and have you participate in some of this really exciting work. So very grateful for all the work out there. Very grateful for the team that I'm on, for SSM really being in the space to champion innovation and investigate these amazing tools and be able to give it a try, see if this will help, see what we can do with it, see how we can build it together. It's not lost on me that there are many organizations that feel a little cautious or want to keep doing things the way we've always done them. And things aren't the way they've always been. So we cannot keep doing what we've always done, because the work is different. And so here we are in the space and charging forward together, being able to carve out a new space, being able to really see what we can do.
Thank you, Julie. Thank you for your passion and for your dedication in this space. And thank you for doing that call out. I love leaving folks with a call out, a call to action of what they can do today differently than they were doing yesterday that will be helpful. And so as we continue to think about how do we transform and how do we shape healthcare so that it looks different tomorrow than it did today, it really is about ensuring that our practicing clinicians, whether you're a nurse, a physician, a pharmacist, one of our rehab professionals, our radiology tech professionals, lean in and start to be part of this conversation. Lean in and start to be part of the solutions, because I truly believe with the power of all of us leaning in together, we'll start to shape a better healthcare for tomorrow. Thank you so much for joining me on this episode of Healthcare Disrupted. We want to hear your voice, so dive into the conversation with us, challenge us, and help us disrupt healthcare for the better. Like this episode, subscribe now, and wherever you get your podcast, follow us on this journey.